Welcome everyone, Dr. Mandell here with you. A beautiful day or night I hope you're having. Regardless of where you are worldwide, I want to talk about the most common cause of torticollis, wry neck, and stiff neck. I'm going to tell you basically why a majority of people get this torticollis. And then I'm going to show you a great, significant, common, but not real well known proprioceptive neuromuscular facilitation, PNF, specific technique I can teach you to help elongate those muscles. Let's talk about what torticollis is. Here's a man, his head is off to the side. Now there's a condition called cervical dystonia when the muscles continually voluntarily squeeze to that side. So for any of our chatters that come into our group, and if you have been diagnosed with this cervical dystonia, I'm going to show you something that can really help you. I've seen numerous cases of these, very common. They use Botox to relax the muscle. That is not getting to the root of the condition. But this man right here is off to the side like this. You can be off to the right side, left side. You can be forward. You can be on an angle forward. You can even go backwards. And when I tell you about torticollis, we think of babies. You know, they come out, they're being pulled from the birth canal, from trauma to the neck area. But when those muscles shorten, they clamp, and they many times don't let go. And you can be in that position for a long period of time, and it's very hard to function, brush your teeth, sleep, or do anything when you can't keep your head in a normal position. So this is called torticollis, wry neck, or stiff neck, but a little worse than a stiff neck. So I put stiff neck in there because people have pain in their neck, and they notice that they may not be true torticollis, but you may be like this. Or you may be like this. I just can't move it. So what I'm going to teach you is going to help you as well. They all fit in the same category. Here is the vertebrae in front. The facet joints are in the back, and the disc in the front. The red area are just vessels. The yellow little nerves, those are nerves coming out between the vertebrae. And you notice that those nerves come out in front of those facet joints. Now, our plan today is talking about those facet joints because it's the facet joints the majority of the time that causes torticollis, wry neck, or stiff neck. So let's show you here. These are the facet joints on the left, as you can see where the red circle is, and to the right. And the purpose of the facet joints is this. I'm going to bring my little guy out here. You know, I'm always like playing with my little guy over here, my spinal guy. These facet joints are back here. Okay, I'll see if I get this to the camera. Now, you have two pairs on each side. You have a superior and inferior facet joint. And these joints, basically, the purpose of them is the head, or the weight of the head, compresses down on those joints so they can fit perfectly. They normally sit at a 45-degree angle on those facet joints. You can look at the picture probably better there. But the purpose of this is every time we move our neck, this is where the gliding is taking place on those facet joints. Okay, so what happens in people who have like forward head posture or people who sleep incorrectly with their head propped down too much or propped high, anything accumulatively with the weight of that 12-pound head puts stress on those facet joints. Now let's look over here. This really what takes us to the nuts and bolts. There's a facet capsule. Now realize that above the facet, the articular facets, you have what they call zygapophyseal joints or apophyseal joints. But in that facet capsule, it's a joint. And what happens is that joint becomes inflamed from too much stress or a biomechanical imbalance. And when that joint becomes inflamed, what does it do? Like any other joint, like a knee joint or any other joint, it starts to swell. And as that joint swells, the muscles, obviously there are many nerves around the area. I'm not only talking about the spinal nerve, but other neurological structures. And the muscles rebound and they start to contract. So in other words, if you are playing a sport, or let's say you sprained or twisted your ankle walking down a step or off a curve, the muscles are going to start to splint. And when they splint on the ankle or the knee or the shoulder, you can't move it. because that is a healing mechanism the body, Mother Nature, has given us that helps prevent that injury from getting worse. Because if you hurt a joint or you stretch a ligament and you continue to use it without feeling symptoms, you're going to cause more damage to it. Does that make sense to everyone? I hope you understand that. We don't want to aggravate what we just hurt. We want to let it rest so it can repair and heal. So with these particular facet joints, when the mechanics cannot hold up, obviously, the force or demand that's put upon the joint, that joint starts to swell. When that joint starts to swell, what happens is the body gets into a certain position because of the muscles that are contracting, usually on one side, and they start to clamp down. So the most important thing for this condition, number one, is getting the right diagnosis, because it's not the disc that's usually causing the torticollis. It's not the pinched nerve that's causing the torticollis. So I want to kind of get that out of people's mind. It's not the herniated disc. It's not the bulging disc. And it's usually not even the degenerative disc. It's the facet joint. It's the zygapophyseal, the apophyseal joint that starts to swell. And when that area swells, the body gets into a point to where now it becomes to a wry neck, a torticollis. Okay, so we have wry neck. What do? Well, not Botox. Obviously, if it's inflamed, you know you hurt yourself, always put ice on it. Use the ice first 24 to 36 hours. Every couple hours, about 15 minutes, put a paper towel with the paper over the ice pack so you don't burn your skin, get frostbite. So we want to reduce inflammation. So we're in this position. So when you have a condition and you're in a position, let's say here I'm in a left torticollis, or I'm in a left forward torticollis, or in a left posterior torticollis, but for our sake, let's just say a left torticollis. Okay, so what's happening is my left muscles are clamping down. Usually the SCM muscles are the most common. So what we want to do, I'll tell people to stretch it. So basically what you want to do is relax, and you want to pull it over. And as you pull it over, you've got to really relax, because the whole idea is to elongate that muscle. So to elongate the muscle, we're going to get to a point like this, and we're going to say, I can't go any farther. It hurts. That's okay. So now what we're going to do, you see my fingers here, I'm going to take my head and I'm going to push against my fingers for 5 seconds. We call this PNF, Proprioceptive Neuromuscular Facilitation. It's a neuromuscular re-education, fooling the brain, tricking the brain so we can get that muscle to relax. So what I'm going to do here is I'm going to come 5 seconds. I'm going to push against my hand like that. 1, 2, 3, 4, 5, and relax. Then from here, I want you to pull more. And guess what? You're going to be able to go more. You couldn't do it until you did that PNF stretch, that resistance. So you're going to go more and say, ow, it hurts. Stop. See my fingers, push against my hand, 5 seconds. 1, 2, 3, 4, 5. Now relax. Now let's push more. Now look where I'm at. I couldn't even get over here before, but look where I'm at now. So we'll try it 3 times, one last time. Push 5 seconds, 1, 2, 3, 4, 5, and then we push a little bit more. The point that I'm making is you're going to notice by doing this PNF resistance, you're tricking the brain. You're sending reflexes from the muscle to the brain back, afferent, efferent, back to the muscle. And we're elongating, we're getting range of motion. The key thing with torticollis is to keep inducing range of motion. As Tina says in the chat room, baby steps. That's correct. That is the answer. It is baby steps, because we're going little by little by little. And the next day you may say, I have my torticollis. Guess what? You're going to do it again. And do it several times a day. There's no harm. Remember, you're only dealing with muscles. You're not dealing with a nerve that's being compressed. You're dealing with muscles. It's okay. It's okay. So as you do this, you'll start to get better. Now, a trick here is, let's say that my head has gone left and posterior. Always pull the angle opposite. So if I'm this way, I want to pull down and to the right. You with me? If I'm down and forward, I want to push back and to the right. Okay? Go actually opposite the muscles contracted. So if I'm straight over this way, I want to pull it directly the opposite way. It's very important you understand that. Okay? If you start pulling in the wrong direction, you're not going to get the results. Now, for people who are dystonic, have dystonia, same thing. Your condition is a torticollis, but it's more of a permanent torticollis, according to doctors. And I've had patients who came in my office like this, that's been like that for 2 years, 3 years. Honest to God. It's horrible to see people like that. And once I teach people this particular technique, I promise every one of you, you're going to see some results, and hopefully great results, because there's no harm. It's called PNF, Proprioceptive Neuromuscular Facilitation. I hope that really helps you, because that's what this channel is all about. It's self-help, helping people save you money, save you appointments from running all over the doctor, spending lots of money, taking drugs, doing things invasive to your body, and getting potential complications that can make your health a lot worse. Please share this video on your social media. Check me out, Motivational Doc, on Facebook. Whatever, a thumbs up you can leave me, I appreciate it. Also, if you don't mind leaving reviews over there on Facebook, Motivational Doc, I appreciate it. I try to always post things out there daily. Check out my videos here, many great videos, hundreds, self-help as well as cutting-edge nutrition. I want to say to our chatters, thank you for being here. Continue to stay proactive and stay positive, okay? That is the key. And keep fighting through those obstacles, because you will get there. Make it a great day, and we'll catch up with you on our next video. Bye-bye now.